Diphtheria is a highly contagious, vaccine-preventable disease that spreads between people mainly by direct contact or through the air via respiratory droplets. The disease can affect all age groups. However, unimmunized children are most at risk. Since December 2022, the Nigeria Center for Disease Control and Prevention has reported multiple diphtheria outbreaks across different states in Nigeria. The spread of the disease has grown, with Kano State being the epicenter, recording over 7,000 cases, which represents 86% of the total infection in Nigeria. At this inaugural press briefing, the Diphtheria Emergency Task Force says of the 8,406 confirmed cases, 6,202, which is 73.7% of the cases, are between the ages of 1 to 14 years.
Interestingly, we have not had that many cases in infants. Infants represent less than 1% of the cases, and this, I think, just tells us that in the more recent times, infants, with all of the efforts to strengthen routine immunization and all of that, still have some protection. Most of the cases, about a third of all confirmed cases, are in the age group 5 to 9 years old, and this is also closely followed by those that are 10 to 14 years. And then we have adults that are 20 and above.
Diphtheria, as you have heard earlier, is a preventable disease. It has cast a dark shadow over our communities, particularly impacting our most vulnerable citizens, our beloved children.
The task force says the Nigerian government is in the final stages of establishing a national diphtheria laboratory to conduct preliminary and confirmatory testing of the disease in the country. Nigeria currently has 14 laboratories in the Diphtheria Laboratory Network, with capacity to support testing.
We recognize that because of challenges of either access or late presentation or inadequate bed spaces or dedicated treatment centers for cases, some states are still witnessing higher than expected fatalities among reporting cases, and we are working very hard to address those.
Reaching the community is something we have been trying to do at all levels, both at the federal level, but mostly at the subnational level, at the state and LGA level. Because providing that information to the parents and informing about the danger of putting their children for not taking some action could actually cost their children's lives.
In terms of how we're supporting the response, it's not just addressing the specific outbreak in itself, but trying to make sure that in the process of addressing the outbreak, we're also building systems that will help prevent a reoccurrence, or that will help us better respond to a future outbreak.
The co-chair of the task force and executive director of the National Primary Healthcare Development Agency insists that vaccination is the best way to rid the country of the disease. However, efforts to ensure swift response to cases in some affected states is being hindered by security challenges.
The federal government recognizes the power of vaccines in safeguarding public health, and our response to this outbreak centers around the belief that vaccination is our most formidable weapon. We have 2 vaccines at our disposal: the pentavalent vaccine administered to children aged 6 to 4 years, and the tetanus diphtheria TD vaccine provided to children above 4 years to 14 years.
As you might be aware, if diphtheria is not managed properly, 5 to 10% of the affected population can die, which means that's a big challenge, which can face any country, which you can also face. Looking at our scenario, it is very critical, like what my colleagues have already said, to bring all the traditional leaders, the religious leaders, the communities, the parents, to make sure that they do support vaccination of the children.
If you've got symptoms that are suggestive of diphtheria, you go to, in those states, you go to the treatment center to be investigated. This is not like COVID, where we have testing centers everywhere. If you have symptoms suggestive of diphtheria in any part of the country at the moment, even outside of the 8 states that we have mentioned, please go to your sort of general hospital or teaching hospital or FMC laboratories.
While calling for the use of face masks in public gatherings to be reintroduced, the NCDC says preliminary and confirmatory testing will continue at subnational and national levels. Georgina Ndukwezainka, Arise News.